Hi, my name is Amy, and this is my continuing education idea for Offsite Lab Services. Offsite Lab is unique in that it primarily serves geriatric patients. We draw blood specimens and deliver not only the blood, but urine and stool samples. It can be a difficult environment to work in. Staff works with patients that can be very sick due to several comorbidities, or even behavioral mental issues such as Alzheimer's. These problems are hard for staff to understand, particularly lab schedules. Staff is routinely confused as to why a patient needs to be visited every day for ProTime, which is a blood test for Coumadin levels, or why a patient needs to be drawn just hours before their death, because we form very close bonds with the patients we work with, visiting a facility every day. So hopefully these possible education sessions can help bridge understanding. The first thing that needs completed is a needs assessment. A needs assessment is a collection of data from learners, or in this case, Offsite Lab Services staff, to determine their learning needs. The subjects that will be gone over will be chronic illnesses and death and dying, which is also hospice care. The surveying questionnaire will ask staff what would they want to focus in those subjects of chronic illnesses and death and dying, such as what is the most important for them that they want to know, what do they need as far as understanding, or what are they struggling with? What are they struggling to understand that frequently happens at the nursing home that a doctor orders? As sort of mentioned before, the audience will be from Offsite Lab Services. Others may participate, such as customer service reps who deal with the nursing homes, but the needs assessment will only focus on the phlebotomists. They're the ones who are actually in the field dealing with issues as far as lab orders and confusion as to why they are ordered. The first learning session will focus on geriatric chronic illnesses. This will focus as to why patients receive a certain kind of care, testing and monitoring, and special instances of testing for dementia or behavioral patients. Staff is frequently frustrated they are out of the loop of knowledge and that they are visiting a patient for blood specimens for days and months on end. So the objective is that staff will understand disease management, treatment, and testing while they're performing their phlebotomy rounds. The other session, death and dying, is a very needed topic to cover. Many in Offsite Lab Services have anger and frustration when visiting a patient for blood testing, and hours later that same patient passes away. In some cases, staff on their rounds visit a patient who had already passed away. Staff needs an insight as to how doctors perform palliative care and hospice care, and why they do what they do, especially when they're trying to meet objectives or requests from the family or the patient, him or herself, before becoming incapacitated. So the objective will be that staff will understand and explore their own thoughts and feelings of hospice care and the various players involved when encountering actively dying patients. Learning will be conducted in a conference-like setting, a mix of lecture and group discussions. It will not be classroom style because Offsite Lab emphasizes a team environment and that we are just healthcare providers who work toward a common goal of providing exceptional service. We need open communication and discussion with educational speaker after they are done imparting information on topics the staff wanted to learn. We want a debriefing so that it will lead to conversation, whether it be clarification, personal experiences, and alternative thoughts on the subject. 2 domains of learning will be covered. Psychomotor doesn't quite fit because staff will not be actively doing a task, but rather these are just thoughts and knowledge that they'll be applying to their job. Cognitive focuses on thinking and analyzation, like what does it say and what does it mean. Staff won't use the higher levels of cognition, but rather the lower levels, such as gaining the knowledge, comprehending what it means, how it applies to that personal situation, and possibly it could lead to analyzation, concluding what a patient will need the next day, such as, for example, a ProTime or an INR level of Coumadin of a 3.2 will mean visiting the patient next day. That requires knowledge of knowing what common INR levels are required for various patients, and if that means if it's high or low. We're not going real in-depth, but enough that there's a gaining of understanding as to why we're visiting this patient with atrial fibrillation or a history of blood clots. The affective domain focuses on feelings and internalizations of thoughts and knowledge. It focuses on what does it mean to me. It will use all aspects of the affective domain, especially for the group discussions. It depends on how that person receives that knowledge. How do they respond? How do they feel about it? What are their personal values affecting how they interpret that knowledge? And how will they use it? An example would be what was observed at a home for a hospice patient, and are we doing what we're supposed to do to meet the needs of that patient, and how is it affecting that healthcare provider in providing the service. 2 teaching strategies will be implemented. Those focusing on young adulthood, or 20 to 40 years of age, and low health literacy. Young adulthood, generally that age group is healthy and have limited experience personally and professionally in health care. So geriatrics is a whole new world. To have to be immersed into patients where they are frail, they are sick, completely different, and requires a whole new mind frame of how you approach a person. Young adulthood, when it comes to learning, most will not learn if it's not something of use or of interest. So the needs assessment previously mentioned is very vital to what we are able to cover. We want full participation and full interest and dedication. So the needs assessment, asking the questions on what would you like to learn, is very important. The other issue of low health literacy is that people in the department, since it's an entry-level like job, only have a high school diploma and some college education. So they don't have the full spectrum of anatomy and physiology, microbiology. They are simply focused on the lab and phlebotomy. So when a speaker talks about dialysis, chronic kidney disease, chronic heart conditions, dementia, or the anatomy and pathophysiology of those illnesses, it has to be simplified. They can use the terms, but they need to provide a practical definition, and that the learning materials given out, such as PowerPoints and handouts, need to be at that reading level and defined succinctly. There will be 2 evaluations, the first one being content, which would be what was immediately gained from the educational sessions. Were the sessions practical for that person? Did that one staff member gain anything? What do they think they may use? What did it mean to them? We need to know the immediate knowledge gained to see if the education was practical. The second evaluation, the outcome-focused one, will be done 1 month post-education. It will ask items such as, what are they using today while on their rounds? Did personal perspectives on lab testing or attitude toward nursing home staff change? Did any items that were covered in education, did it confuse anyone, or were there any issues? And any ideas if such a session were to happen again, what would they want to focus on again? What do they want expanded upon, or any new ideas? While some of these are highly subjective and could even be a research project, it just gives us a baseline as to what were the immediate outcomes and what's the general attitude of the department after education. Barriers to teaching. The first problem can be time. There will be a 2-hour window for each session. First hour dedicated to lecture, second hour can go to discussions with the speaker. Discussions we can have more time for on another date, but we do need the lecture to be completed first. And we will schedule more educational sessions if there is a positive response for more. Second problem is the priority. We want to choose a speaker who wants to be there, for a bunch of phlebotomists. Third problem is competence, and we will ask about a potential public speaker or lecturer, their past teaching experience, and if they can provide a base knowledge to the phlebotomists and simplify definitions and terms for them. And we will want to look at learning materials beforehand for readability. Fourth problem is effectiveness, and we will discuss sessions with the manager as far as implementing this idea. And the last problem is motivation and the skills of the teacher. We will stress to the speaker that staff is interested based on the needs assessment and will provide the answers to that assessment, and that staff wants to understand more and be more proactive in the services they provide. Obstacles to learning. Some problems are time, which was mentioned with barriers to teaching, that there will only be 2-hour sessions, but we will try to offer more or provide more discussions at a later date. Second problem is readiness or motivation to learning. This is addressed through the needs assessment, so we can target what staff wants to learn or problems that they want an answer to. Number 3 would be the complexity or the control, and that would be the encouragement, and that this is going to be done in an environment where they can stop and think, and not the hustle and bustle of some of the nursing homes. The fourth one is the denial of needs of education, and we will want to emphasize that there is something to gain from these, that there is some control of what they want to learn and what they want to understand more. Number 5 is a lack of support is another issue, and we want to emphasize that these sessions are for off-site services staff, that we want the staff to be successful, that we want them to learn more and understand more and be more proactive. The next problem is behavior changes. The actual behavior changes is not all that great. There won't be a change to how they practice or do their rounds, but rather a gain of knowledge to help curb frustration as far as why they visit and the frequency or issues that they encounter while visiting patients. Seventh problem is the environment, which is solved by having a conference room setting where they can look at each other and discuss issues and have questions answered, and finally have questions answered as far as how patients are cared for. And the 8th issue is literacy, which we had mentioned in the teaching strategies, that terms need to be simplified and need to be explained succinctly to their level, and we will provide learning materials or notes that are at their learning level. In conclusion, sessions would provide more benefit than doing nothing at all. There is no harm in staff asking questions and receiving answers, just for the pure sake of learning and gaining knowledge, especially when the questions are targeted toward confusion and problems they encounter in the nursing home. It may help reduce stress and grief when working with clients at the facilities, such as why doctors order the tests they do and at what frequency, why nurses respond the way they do, and why patients receive the care that they do. We want to enlighten and invest in our staff, not only personally and professionally, but also to provide an extra level of service to the patients we serve. This is my PowerPoint on continuing education sessions or off-site lab services. Thank you, and have a good day.